Opening. Do you suffer from rheumatoid arthritis and are looking for ways to manage the pain? Welcome to our discussion today, where we will explore some top ways to relieve chronic pain from this condition. Rheumatoid arthritis, or RA as it's often referred to, is a chronic inflammatory disorder. It primarily affects the joints, leading to pain, stiffness, and swelling, but it doesn't stop there. RA can also impact other systems in your body, making it a complex condition to manage. The pain, as many of you know, can be relentless, and finding ways to alleviate it can sometimes seem like an uphill battle. But fear not. Today, we're here to explore some effective strategies to manage this chronic pain and bring some relief to your day-to-day life. So if you're ready to arm yourself with knowledge and take control of your RA, let's dive deeper to understand RA and its symptoms. RA typically begins in the small joints of the hands and feet. It's like a stealthy intruder, starting small, affecting the tiny joints of your fingers and toes first. You might notice a little stiffness in the morning, or some minor pain when you grip something too tightly. It seems innocent at first, but it's just the tip of the iceberg. As the disease advances, it's like a fire spreading, reaching out to other joints. The hips, the shoulders, the ankles, the elbows, and the wrists can all become victims. The pain and stiffness increase, and the joints may swell, making simple tasks like opening a jar or tying your shoes a challenge. But rheumatoid arthritis doesn't stop there. It's not content with just causing joint pain. It can lead to chronic pain in various other parts of the body. You might experience headaches that seem unrelated to your joints. You may develop bone spurs, those little outgrowths of bone that can cause additional pain and discomfort. And why does this happen? It's because rheumatoid arthritis is an autoimmune disease. It's your own immune system mistakenly attacking your joints, causing inflammation and pain. It's like a civil war happening right inside your body, with your immune system on one side and your joints on the other. Rheumatoid arthritis is a complex disease, and its symptoms can be diverse and unpredictable. One day you might feel relatively fine, and the next you could wake up with a flare-up that leaves you struggling to get out of bed. And unfortunately, there's no cure for rheumatoid arthritis. But the good news is, there are ways to manage the symptoms and slow down the disease progression. Prescription drugs are often used to manage the pain, but they don't address the underlying overactive immune system. However, they can help you live a more comfortable life, while other treatments work on controlling the disease itself. So, while rheumatoid arthritis is a formidable enemy, it's not unbeatable. Armed with knowledge and the right treatments, you can fight back and reclaim your life from RA. Prescription drugs play a significant role in managing RA pain. This statement encapsulates the importance of medication in the fight against the discomfort caused by rheumatoid arthritis. Let's delve deeper into this topic. Imagine you're experiencing a headache. What's the first thing you do? You probably reach for a painkiller, right? Well, it's similar for those with RA. Prescription drugs offer a much-needed respite from the relentless pain. These drugs are designed to alleviate pain and inflammation, providing immediate relief. However, it's essential to remember that these medications are not a cure-all. They're akin to putting a Band-Aid on a wound, but they don't treat the root cause. You see, RA is an autoimmune disease. This means the body's immune system mistakenly attacks its own tissues, causing inflammation in the joints. While painkillers can mitigate the pain, they don't address this overactive immune response. So how do we tackle this issue? The answer lies in combining these pain-relieving drugs with disease-modifying anti-rheumatic drugs, often referred to as DMARDs. These medications work by interfering with the immune system's ability to cause inflammation in the joints. They're the hard hitters that work to slow down the progression of the disease and prevent joint damage. But it's important to understand that every individual's experience with RA is unique. What works for one person might not work for another. Therefore, the treatment plan is often tailored to the specific needs of the individual. This might include a combination of different medications, including corticosteroids to quickly reduce inflammation, or biologics, which target specific parts of the immune system. Remember, medication management is a crucial part of RA treatment, but it's not the only tool in the toolbox. It's a bit like cooking a delicious meal. You can't just rely on one ingredient. You need a combination of flavors to create something truly delightful. While prescription drugs are crucial, alternative therapies can also help manage RA pain. So let's explore these additional options in our next segment. Alternative therapies can provide additional relief from RA pain. While conventional medicine plays a crucial role in managing this chronic condition, there's a growing interest in complementary approaches to enhance overall well-being, and quality of life. One such therapy is meditation. This ancient practice is more than just sitting quietly, it's a journey into self-discovery and relaxation. It helps you tap into a state of inner peace, which can be incredibly beneficial in managing RA pain. When you meditate, you're not just relaxing your body, but also your mind. This state of relaxation can help lower stress levels, which are often linked to increased RA pain. Meditation is also thought to help reduce inflammation by regulating the body's immune response. This is crucial for individuals with RA, as their immune system mistakenly attacks their own body tissues, causing inflammation and pain. By reducing inflammation, meditation could potentially lessen RA symptoms. But how do you meditate? Start by finding a quiet, comfortable place where you won't be interrupted. Sit or lie down, close your eyes, and focus on your breath. Allow your thoughts to come and go without judgment, and try to bring your attention back to your breath whenever your mind wanders. Even a few minutes of meditation a day can make a difference, so don't feel like you need to spend hours in silence to reap the benefits. It's important to note, however, that while meditation and other alternative therapies can assist in managing RA pain, they should not replace prescribed RA treatments. They are meant to complement your existing treatment plan, not substitute it. Always consult with your healthcare provider before starting any new therapy to ensure it's safe and suitable for your specific needs. In addition to these therapies, exercise and stretching is vital for managing RA pain. Regular movement can help keep your joints flexible and strengthen the muscles that support them, reducing the strain and subsequently the pain. But remember, it's not about pushing your limits. It's about finding a balance that works for you. Daily stretching can improve circulation, flexibility, and reduce pain. This is especially important for those dealing with conditions like rheumatoid arthritis, where stiffness and discomfort can be a daily struggle. Now, when we talk about exercise, we don't mean heavy weightlifting or high-intensity cardio. We're talking about gentle movements that can help keep your joints flexible and your muscles strong. Think about activities like Tai Chi or yoga. Both of these practices focus on slow, controlled movements and deep, mindful breathing. They're not only great for your body, but they can also help manage stress, which is a significant factor in chronic pain. And don't worry if you're not a yoga master or if certain positions seem out of reach. Many yoga poses can be modified to suit your individual abilities and limitations. It's not about forcing your body into a pretzel. It's about moving in a way that feels good and beneficial to you. Now, let's talk about some simple stretches. Wrist bends, for example, are an easy way to keep your hands and wrists flexible. Extend your arm out in front of you and gently bend your wrist up and down. Make sure to do this slowly and gently, without causing any pain. Finger curls can also help keep your fingers agile. Simply make a fist, then slowly uncurl your fingers, stretching them out as far as comfortable. Remember, the goal here is not to push your body to its limits, but to gently encourage flexibility and strength. If something doesn't feel right, or if a particular stretch or exercise causes pain, then it's time to stop and adjust. The last thing we want is for your exercise routine to become another source of pain. Along with exercise and stretching, lifestyle changes can also help manage RA. It's all about finding a balance that works for you, a routine that not only helps manage your symptoms, but also fits in with your lifestyle and capabilities. It's your journey, after all. Maintaining a moderate weight can significantly reduce stress on your joints. It's like carrying a lighter backpack. Your body will thank you for it. One of the best ways to achieve this is by incorporating healthy eating habits into your daily routine. You don't need to embark on a crash diet or deprive yourself of the foods you love. It's more about making healthier choices, like eating more fruits, vegetables, lean proteins, and whole grains. And let's not forget about regular physical activity. It's not just about hitting the gym or running a marathon. It's about staying active in a way that's enjoyable and sustainable for you. That could mean a brisk walk in the park, a dance class, or even gardening. Remember, it's not a race. It's about making small, consistent changes. By incorporating these tips into your everyday life, you can better manage your RA pain. It's all about giving your body the best possible chance to thrive, despite living with RA. Let's recap the key points we discussed today. Rheumatoid arthritis, or RA, is a chronic inflammatory disease affecting joints, causing stiffness and swelling, and can result in chronic pain. It's important to remember that prescription drugs play a crucial role in managing RA pain. but they should be used in conjunction with disease-modifying drugs to prevent joint damage. Alternative therapies like meditation can also help manage pain and should be seen as complementary to prescribed treatments. Incorporating daily stretching and gentle exercises such as Tai Chi and yoga can significantly improve your circulation, flexibility, and reduce pain. Remember, lifestyle changes like maintaining a moderate weight and adopting healthy eating habits can have a tremendous impact on reducing stress on your joints. And above all, consult with your healthcare providers to develop a comprehensive RA management plan that's tailored just for you. Thank you for watching. Please like, share, and subscribe for more health-related content.